One of the most common types of dizziness that we see here at Peak ENT is a type of vertigo that we call benign positional vertigo. It's the most common type of vertigo that occurs in adults, and it can occur in almost any age range. It's often associated with trauma, but sometimes can happen just spontaneously without a good reason. What ends up happening for patients, and maybe what I can do is, the inner ear function is very delicate, fragile, but very fine-tuned instrument. There are two parts to the inner ear. You can see here the outer ear, the eardrum, and the inner ear. It's very small, very minute, but if you look at the inner ear system, there's two parts. You have the cochlea, which takes care of your hearing. And then you have the vestibular apparatus, which is this portion, which is a significant portion of the neurological function in the ear. This sends signals directly to the brain, which are related to balance and movement and perception of movement in space. If you look just at the vestibular apparatus, there's two main sections of the vestibular system. This central portion, which is kind of a globus portion, is called the vestibule, and it has the saccule and the utricle. I'm using big words, but basically, if you look at this blow-up picture down here, there are little crystals in that portion of the ear. And these crystals are embedded on a little layer of gel, and hair cells on that gel can sense whenever those crystals are moving in any direction. The purpose of these are to let you know when there are acceleration changes. And basically what that means is they can pick up signals of gravity because the crystals will be pulled downward, or they may also sense like when you're starting or stopping in a car. So they're very important for our sense of where we are in space and how we're moving in space, okay? The second portion of the balance system is called the semicircular canals. These have very different receptors right here in the middle portion. These receptors, this is a picture or a blow-up of it. It's called, in the ampulla, there's something called the cupula. And I like to think of the cupula kind of like a sea anemone blowing in the winds of a tidal pool in the ocean. It's very sensitive to motions of fluid. That fluid motion is sensed anytime we turn our head in any direction. We have a canal which is lined up in all three dimensions of space, and so if you turn your head, these cupula can send signals to your eyes to turn in the opposite direction so that you can keep your head focused and your vision focused at all times. In benign positional vertigo, crystals will break off of this central portion of the ear and sometimes fall into these back alleys, these semicircular canals, and give false signals of motion when no motion is present when you make positional changes. So if someone has benign positional vertigo, it's most common to get dizzy when they lay down, roll over, or look up or put their head down. The vertigo, which is a spinning sensation usually, lasts for just a few seconds, but may leave someone feeling severely nauseous or off balance for hours afterwards. We can actually fix this problem very easily, the majority of the time, by actually repositioning those crystals so they go back with a few simple maneuvers in the office. And we have a high success rate of curing these patients with just a few visits.